I want to introduce Dr. Linda Daniel. You'll have to tell us what division you are in. I also want to promote, for extra points, I'm going to be giving everybody extra points participating in the Walk Indiana. So you can start now, and I'll pass that information out to you. There is registration. And also, there are 12 scholarships that we can provide, thank you to Women of Influence. So there are some scholarships. It is $25 to enroll, but you get a really nice package at the end. So
very nice stuff. Cute t-shirts and everything.
Yeah. So we'll go ahead and get started so everybody's on a really limited time.
Hello, welcome everyone. I'm so glad to see a pretty decent crowd here. Did everybody get a handout? Okay, good. I work with the Family Medicine Residency. I'm on the faculty there, have been for about 12 years now. You can go to the next slide. One of the big things that I teach the residents is about this whole mind-body connection. There was a physician back in the 70s, George Engel, who came up with the term, the biopsychosocial model. And prior to that, medicine was pretty much focused on disease and illness occurring in this kind of biological vacuum. But since that time, there's been this movement for an integrated way of looking at health, where you look also at psychological, mental, social, spiritual, all those aspects and how that affects illness and health. So that's my big job, working with the physicians in training and teaching them the importance of this integrated health model. Okay, so today we're going to specifically be talking about stress. So we'll define stress, what are some of the symptoms of too much stress, what causes stress, why exactly is stress harmful, and what are some of the ways that we can manage stress in our daily lives. And actually, I think if you just go out, if you didn't come here and just went outside and sat on the plaza, that all your stress would just kind of evaporate, wouldn't it? It's just a beautiful day out there. So that's one way to manage your stress immediately, just get outside. So in the beginning, we used to talk about stress in physiological terms as the wear and tear on your body, the physiological impact of the stress. And then later on, a non-specific response of the body to any demand that is made upon it. Any condition that harms the body or damages, breaks down, or causes the death or many cells. So it was a real focus on the physical aspects of too much stress. And this is kind of a circular way of defining stress. It is itself, it is the result of itself, it is the cause of itself. Because what happens, there's something out here that happens, or something in here that happens that causes stress, and then you experience stress, and then it leads to this emotional distress. So this is one of my favorite definitions. Herbert Benson is a psychiatrist out of Boston. He actually spoke at Ball Hospital a few years ago. He was kind of famous for his book called The Relaxation Response. Has anyone ever read that? Relaxation Response. He focuses on meditation and breathing exercises as a way to naturally lower your blood pressure. So just by focusing on your breathing, you can actually lower your blood pressure. But his definition of stress is any condition that forces a person to change or adjust. So this can be a good thing or it can be a bad thing. You just have to adjust to whatever it is, and that's what causes the stress. So we also know that the amount of stress depends not on what happens to you, but also how you perceive it, how you perceive what is happening to you. And really the overload is based on your perception, your point of view. So in your handout, I want you to just take a second. It's on the back of the first page.
Who needs one?
There should be some more over there.
What's the name of that book again?
The Relaxation Response.
See, I have extra. By who?
You have extra. Okay. Who needs a handout?
Okay, so go ahead and take a look at this questionnaire on the back. This is the perceived stress scale. And this really gets at how you are perceiving what is going on in your life. So the questions in the scale ask you about your feelings and thoughts during the last month. In each case, put an X in the box that best describes how often you have felt or thought a certain way. Add all of the numbers in the boxes you marked with an X, and then write the sum in the total score below. So you can just do this on your own. Just this only takes a couple minutes. So in the last month, how often have you been upset because of something that happened unexpectedly, and so on. Go ahead and fill those out, and then total up your score. I've done this, and for those of you who don't have it yet, please do it afterwards. But you can kind of interpret the score you have by the scale at the bottom. So if your score was between 0 and 7, it's much lower than average. So your health concern is pretty low. But if your score was 21 or over, that's much higher than average, and your health concern is very high. And what we know is that if people have high scores on this perceived stress scale, that you are at a high risk for obesity, depression, and inability to fight off infection and some cancers. So the higher your perceived stress is, it really does impact your health. Okay, I think we can go on to the next slide. All right. The thing to remember, though, is that emotional distress is a normal response. It's not pathological. Anytime you experience a threat, you have one of these three responses. Fight, run away, so flight, flee, or freeze. And then there's the three basic emotional responses are anger, fear, and sadness. It is just that basic. When you're under threat, this is what happens to you. This is just who we are as human beings. Now, it's okay when the distress is short-lived. If you manage that and then you're able to calm down immediately after that threat, but if you let it go on and on and on, that's when you start to have a breakdown in your body and you have a physical health problem. We all respond. We respond to all threats, whether they're real or imagined. I want you to think about the last time you had a near-miss accident, when you're driving. So maybe you screeched your tires and you're there like this, and think about what your body tenses up, your heart starts racing like this, you start breathing faster, because that was a threat. Your body immediately responds. Do you have control over that response? Absolutely not. That's an automatic response to that threat. Now, if you're a worrier or you ruminate on it, that's going to affect you all day long then. You'll hold it in your muscles, you'll hold it in your thoughts, so you allow it to become a chronic threat. When if you could just let it go, then you won't have the health response to it. So, there are times where adaptive can become maladaptive, where it's no longer protective, and that's one of the examples. So it's protective to have that immediate emotional response, but if you hold on to it too long, it's not. I have worked with folks who grew up in pretty, just really kind of bad home situations, domestic violence situations. And so that their adaptive response to those situations was to be hyper-vigilant. They looked around their environment, they were constantly aware of what was going on, and what that happened what resulted in from that then was that they couldn't focus on any one thing over a period of time. They could not focus consistently because they're always looking over their shoulder to see who's going to come through that door. I need to be aware who's going to come in here and be a threat to me. Now, in that situation, that's a very adaptive thing, isn't it? To be able to be vigilant of a threat. Now, when you're in a non-violent situation, it's no longer adaptive. And the case I'm thinking about, she was in thinking she had adult attention deficit hyperactivity disorder. And how I explained it to her was, no, at one point, that inattention and that inability to focus on one thing at a time, that was adaptive in a violent situation. But now that you're in a more healthy environment, it's no longer adaptive. And that's what you need to work on. And taking Ritalin or Vyvanse or whatever medication she was thinking of, that's not going to help that. She needs to think of an adaptive way to learn how to focus. And there are techniques you can use. So, We also experience emotional distress from frustrated wants. Frustrated wants to us become a threat that can lead to one of those natural distress emotions of anger, fear, or sadness. When we don't get what we want, we get distressed. When we get what we don't want, we get distressed. And the problem is, we live in a culture that promotes this message. You can have whatever you want, whenever you want, but it doesn't teach us how to deal with frustration appropriately. Think about when you all were children. Did everybody have their own room? Did everybody have a television in their own room? Did everybody have their own iPod? Or did you have to share a television? Did you have to share a stereo? Did you have to share a telephone? Mm-hmm. We all had to share, didn't we? Think about what children have now. When do children learn how to share? Do they ever? I mean, think about it. I remember when we'd take family trips and the three of us would sit in the back seat and we'd argue over, oh, she's touching me, she's on my side of the, go back and forth and change the radio station, and we'd yell at each other to get off the phone because we only had one phone. We all didn't have our cell phones. We learned to share that way, though, and we also learned how to manage our frustration because we couldn't have everything we wanted exactly when we wanted it. We learned to tolerate frustration, and so now as adults, frustration is not as stressful to us. But you take kids now, and they have very, very low tolerance for frustration. So their stress levels are up here, right? Because they can't tolerate frustration. It's a very different world we live in now.
Are these things on a handout?
No. I can get these PowerPoint slides for you, though, if you want me to send them to someone.
Yeah.
Okay.
There's more.
Okay. So I think the important thing to remember, too, is when there is no adaptive purpose to distress, it becomes self-defeating, damaging to your mental and physical health, and it also damages your relationships. Okay, this is something that I'm constantly working with family physicians about. That stress of living, this distress, is not an anxiety disorder. It's not a mood disorder. This is not pathology. This is just we're just human beings, and it's just our experience. Anxiety and mood disorders are diagnosed by a healthcare provider. They're serious illnesses that require medication to work on that brain chemistry that's gone awry. Medications like Valium, Ativan, Xanax, any of the what we call benzodiazepines are like alcohol. They're addictive and relax you whether you have a mental illness or not. So everybody could use a Xanax every once in a while to relax them, but that's an unhealthy way to deal with just the distress of living because it can become addictive and you need more and more and more and more. True anxiety disorder must be treated with weekly counseling sessions and close review of medications. It's a serious illness. This is a quote out of the National Psychologist newspaper from January, February 2011. I just think this is so appropriate. Antidepressants are everywhere. They are prescribed not only for the Monday morning blues or any degree of sadness, but also for such things as erectile dysfunction, smoking cessation, obesity, obsessive compulsive disorder, and even bereavement. So when you're grieving over the loss of a loved one, you might get an SSRI. With that latter practice interfering with and severely limiting your ability to actually cope with that loss. When you lose someone, or it doesn't even need to be a loss of a person, it might be you've lost your job, or you've lost an opportunity for something. You need an opportunity to grieve over that, and if you're just numbed by that medication, you have not learned how to cope. And you have to learn how to adjust to that loss before you can move on in a healthy way. The good thing about stress is, and this is why I said just a spoonful of stress, because it actually is motivating. We wouldn't get anything done if it weren't for deadlines and the stress that pushes us forward. It just motivates us. The other thing that we do know, we've done a lot of psychologists have done a lot of research into this, that change, whether it's positive or negative, creates stress. So can you think of a positive change in your life that might create stress?
Getting married.
Getting married.
Having a kid.
Graduation. New job.
Grant deadline.
A grant deadline. Yes, yes.
New baby.
A new baby. Yes, all those things are very positive changes in our lives, but boy, do they create stress, even though they're positive. So in your handout, I think too, yeah, you can do this later. We don't need to do this right now. This is the Holmes and Rahe stress scale. These are a couple of social psychologists that years ago put this together, and they were the ones who really came up with that idea that it's the change that causes the stress. Not the type of change, but the change itself. We also know that it's not just these big major life events that cause stress, but also the nuisance of daily hassles. So if you're living with a lower income, maybe your spouse or partner has lost a job, or maybe there's been a change in how much you're reimbursed, just those daily nagging changes that you have to deal with because of an economic change, that can cause stress. We also know that point of view. Your point of view can create a lot of stress too, and that gets into that perception of stress. So actually, I think also in your handout, on the back of the Holmes-Rahe scale, you can look at this later too. These are the filters through which you perceive stress, and then the signs and symptoms and outcome of these stresses. So you can look at that later. You know that lifestyle choices can create stress as well. So if you're not planning adequately for things to happen, if you're involved in toxic relationships where they're just negative, and if you don't engage in enough self-care, where you aren't taking care of yourself physically or emotionally or spiritually, we know that your stress can build, and then you can have physical problems because of that. So with lifestyle choices, when you look at your cell phone and it's one of those annoying people in your life that when you get on the phone with them and you know it's going to be an hour conversation, what do?
Ignore it.
Ignore it. Let it go to voicemail, right? I'll deal with that later, because you don't need it right now. Especially if you had a rough day all day at work and it's in the evening and you're just trying to relax, watch your favorite TV show or work out in your yard or something, and you see this person kind of bothering you, just let it go. Yeah, call them tomorrow.
Wouldn't that create more stress thinking about, oh, I gotta call them?
Who's in control if you call them?
You are. I don't know.
You call the shots that way. You call when it's convenient to you. And even plan out what you're going to say, especially if you have an idea why they're calling. Okay? Worry creates a lot of stress. There is a physiological impact of unremitting worry. Worry is an internal stressor, and we also know that it does affect your immune system. We know that you're more vulnerable to colds. If you are exposed to a virus, you're more likely to get the sniffles and feel it in your body and just not be able to bounce back as quickly once you do catch a cold. We also know that worry blocks active problem solving. There's a lot of people that spend their whole day, their whole lives saying, what if, what if, what if, what if? And you know, most of those things don't happen, but you're using all this mental energy, this emotional energy saying, what if, what if, what if? And as long as you're doing that, you're not saying if, then. If this happens, then I have this plan and this is what I'm going to do. If that toxic person calls me tonight, then I'm going to say this, or I'm not going to pick up that phone because I've got other things I need to do tonight. And I'll call them tomorrow. So you have a plan. So if you're doing all of this what-ifing, you don't get to the if-then problem solving. Worry's distressing and just adds to our misery. And the other thing is, a lot of worriers, chronic worriers, have insight into their worry, and they worry about their worry. And I know I shouldn't do this, but I worry about my worry. And so it's kind of this spiral downward and creates even more stress. So there are lots of symptoms of this stress of living. It does take a toll on all aspects of our lives, physical, mental, spiritual, emotional, and social. With the physical side of things, we know that you are more vulnerable to developing illness, pain. With mental health, you lose concentration, there's memory loss. I remember back in the, I guess it would have been the mid-90s to late 90s when I was still working in the hospital. I ran the neuropsych lab and I did a lot of outpatient evaluations. That was the time where there were a lot of layoffs in the community. We hadn't quite hit that peak of loss of, 12,000 jobs, but there were a lot of middle managers coming into the neuropsych lab saying, I have adult ADHD, what's wrong with me, I'm losing my mind, or they thought, I'm developing early Alzheimer's, I can't remember a thing. Well, of course, it was the stress, the anxiety about the job loss, the changes in their finances, the changes in their role, the fact that there would be a loss of prestige. There were all those things that were impacting how they saw the world, and it created a lot of stress. So there is a huge mental toll if you're under stress. Spiritual health, if you have kind of what we call an existential crisis, why am I here? What am I doing? I don't have any purpose. You've lost this sense of meaning, a lack of clarity in what is really important and what you value. That can come from stress. And if you do happen to go to church, and if you've been involved in church politics, you think, what are we doing here? Because there can be as much stress in those kinds of environments as in work or in home as well. And of course, we know with emotional, the signs are sadness, worry, and anger. And then with social health, if it's just a loneliness or maybe an over-dependency on others, can be signs of stress of living. So in your handouts, I think, what's the next slide? Yeah, back. Okay, so we're just going to review this, too much stress. This is in your handout. So I've kind of broken this out into, so these are the symptoms in each of these areas. So physical, mental, emotional, social, spiritual. And then these are the causes of the symptoms in each of these areas. And then on the back side of it are some stress management strategies that you can use to address each of these symptoms. So let's look at these symptoms. And I'll just pull a couple of them out of here. Because I think what happens, people will have stress in their lives, and sometimes they're not even aware of it because they just live under stress every day, constantly, and a lot of times it's work-related, or maybe in your neighborhood, you just live in a stressful neighborhood, and you don't even realize how stressful it is. Same thing in relationships. You may not realize how much stress is coming from a relationship that you're in. So these are some of the signs and symptoms. So physical symptoms, you might be more accident prone, your blood pressure might be affected, you might have a lot of headaches or really tired, you might have pain all over. I have seen a lot over the years, I've seen a lot of folks with fibromyalgia and chronic pain, and I'll say, what's your stress level? And well, I don't have any stress, it's the pain that's causing the stress. And if they were to step back and really examine what's going on, they kind of had a spiral downward in what can happen in their environment and other ways that is actually causing this stress and pain. Oh, there's some other, yeah, just sexual decline, not your poor immunity where you're not able to fight off colds, and you might have either yourself or others seen this where during finals week from school, after you get through those finals, you just crash and burn. I mean, I used to do that. I'd go home on breaks, and I'd be in bed for like 3 days, and my mom would think I was dying. No, I just held it together long enough to get through that finals week. But it was all that stress of finals, and also sleep deprivation. If I wasn't sleeping adequately, then you're not able to fight off colds and flu as well. So then there's some symptoms in the mental domain, even things like loss of creativity, a loss of a sense of humor, where you just can't find funny in anything, where you just kind of maybe sarcastic and not your usual self, not able to experience joy. Maybe you just don't care. You've got some apathy. You can't come up with any new ideas. Maybe there's this confusion or muddiness in your thinking. And then all the emotional signs there. Some of the social signs where you just decide, I just can't stand to be around people, so you become a hermit, basically. And then those are the spiritual symptoms. Maybe there's a sense of despair, loss of meaning. You kind of go through those. So then let's look at these causes of these symptoms. The physical realm is usually pretty easy to understand. We know that if we're not eating right and not getting enough sleep, that can be a cause, a contributor to our stress levels. I don't know, does anybody have insomnia in here? You know, yes, you know when you're under too much stress by how much sleep you're getting. The problem with that is it kind of spirals downward then. You aren't able to tolerate frustration. You aren't able to cope with stress. And again, that's kind of a vicious cycle. We also know that the best way to be able to stay on a diet and actually maintain your weight loss and stay the course, you know what it is? It's sleep and stress management. People are able to stay on their diets better if they get adequate sleep and manage their stress. And it actually all goes together, though. It really does. But there's been some research lately in the obesity literature that if you manage your stress, all those psychosocial things, you're much better able to stay the course. Keep up your exercise, keep up your diet. And I have found this, when I go on vacation, I can eat so much more healthy. I'll eat fish and I'll eat, vegetables, and I don't eat as much. I watch my portions. And then when I'm dealing with the stress of work and people knocking on my doors, you got a minute? You got a minute? You got it? Because I'm the in-house psychologist, right? And anybody walks my door, you got a minute? Yeah, I guess I do. And so then, I hear it. So it's kind of a stressful position to be in. And what do? I go get some M&Ms, peanut M&Ms. That's my vice. That's how I cope with it then. So there's this emotional eating from the stress. I don't do that when I'm on vacation. Yeah. So if you learn to manage your stress, you can manage your diet. Yeah.
You must not go on cruises.
Pardon?
You must not go on cruises.
No, I don't. No, I don't. No, but those cruises, I've been on one cruise in my life, and my friend it's been a couple of years ago. She has six kids. And this was their last big family outing. She lost her husband when her youngest was just an infant. And so she was a single mom, raised these 6 kids on her own. It was pretty incredible. But she wanted to take him out on a cruise, and we were talking, and she said, "Hey, why don't you go with us?" Like, I think that'd be more stress. I don't know. I think that'd be more stress than enjoyment for me. But it ended up being a wonderful, it was a good, enjoyable experience. It was. But you talk about the food. There's non-stop food, isn't there? I don't think that was the only time I'd ever been on one. Yeah. Okay. So, social stuff too. Causes in your social life, things like when you move, job change, divorce, death, if you overcommit, if your marriage is maybe struggling, or if your children are kind of getting into things, or if you're being pushed to conform in some way. Maybe you've joined a group and you're trying to fit in. If there's a change in status, sometimes, I've talked about this at the poverty breakfast, that if you are moving into a different economic status, it really is difficult to go with those group norms if what you come out of is not necessarily that middle socioeconomic income. That can cause some, you might feel like you're a phony, and that's one of the social signs of stress. If you're feeling not as genuine as you'd like to be, you don't know who you are. Sometimes that comes out of a change in social status. And then those spiritual causes there. So yeah, I mentioned the church politics, if you have a more materialistic point of view and there's just this sense of, is this all there is in life? And that's an existential crisis where you're really trying to find some purpose. Okay, so the stress management strategies on the back then, these are ways in each one of these domains that you can address the stress if it's coming from that particular domain. So for example, let's go with social here. Find new friends, smile more, eat meals together. We know that people who eat with their families and eat with their friends are in general happier people. Trust, express gratitude, reach out, all of these things. You can look through these things later on, but the key point down at the bottom is your life will be worth living if you select just a few of these things and consistently work on them. You will see a difference in the way you feel. It will reduce your stress. So the physical things, I imagine you're working on these physical things where you drink more water, change your eating habits. I think that's part of this program where you change those physical things. But then there's these other mental, emotional, social, and spiritual things that will help your overall being. Okay, that's good. Okay. So what we can control, of course, are our irrational beliefs, our expectations about the way things should go. We may not be able to control everything, but we can control how we respond to what happens to us and what we think about what happens to us. Albert Ellis was a famous psychologist who developed a therapy called rational emotive therapy, and these were some of his ideas that he believed the root of all mental illness and dissatisfaction with life was caused by our irrational beliefs. So this is one of them. It is an absolute it is absolutely necessary for me to have love and approval from my family and friends. And that sounds kind of out there, but think about, especially like around the holidays, you get stressed out around the holidays because you want things to be perfect. I want to buy the perfect gift. I want approval from my family. If I don't do the right thing, I'm going to feel rejected or I feel like I've let them down. That's a perfectionistic tendency that causes stress. It is a horrible thing when people and things are not the way I want them to be. I use my niece as an example here, but she works at Target, and she's living with me this summer, and she'll come and she will complain bitterly about the customers that come through and are just rude to her. And I know it's hard, but when you're in the public and you're in retail, the customer is always right, and it doesn't matter if they're rude to you. If they are, just let it go. It's not about you, it's about them. If they want to be rude, let them be rude. You have to rise above that and be a better person. But it is a horrible thing when people aren't nice to me the way I want them to be, and that causes a good deal of distress in a lot of people. So at the root of all this irrational thinking is this assumption that things are done to you, you're a passive bystander, and events cause your emotions. So when this happens, I'm mad. When this happens, I'm sad. When this happens, I'm aggravated or whatever. So that really got me down. She makes me so nervous. Places like that scare me. Being lied to infuriates me. He really upset me when he ignored me. So you're this passive victim. All these things out here are happening to you, and you have this emotional response from this event. So when A happened, this activating event, this is Albert Ellis, the ABC theory. So when this activating event occurred, I felt this way, this emotional consequence. But what he says in the middle there's this whole belief system. Oftentimes these irrational beliefs where we're saying it's a horrible thing, it's awful, it shouldn't have happened that way, shoulds, oughts, musts, those irrational beliefs about it, and then that's what causes the emotional reaction. Because if you're able to alter those beliefs, oh, it was inconvenient, it's not the end of the world, yeah, that was kind of a bad thing, but I'll get through it. You have to change, you reframe it. You change the way you look at it. So I think I have, yeah. So how can you tell the difference? It seemed rational at the time. We do get into this. Well, I felt like it was rational, but it wasn't. So that road rage thing, yeah, it was rational. So how do you refute irrational ideas? You write down the facts. So what was that event, that activating event? Write down your self-talk. What were you saying to yourself? Oh, he was so stupid, or that makes me so mad, or there's things in your brain that are going on that are irrational. So write down your self-talk and then focus on the emotional response. So what you do, you dispute and change that irrational self-talk and substitute it with alternative self-talk. So that's when I say it's just an inconvenience. It's a nuisance. It's not a tragedy. It's not the end of the world. It's just inconvenient. So he talks about language that you have to look for. So this awfulizing, catastrophizing. So what really is awful about this situation? You look for beliefs like, I can't stand it. What about this is really unbearable? So they looked at you funny. So they said something funny to you. So why is that the end of the world? Why is that a catastrophe? Why is that tragedy? You look for blaming and damning. What is unforgivable about this? And look for masturbating. That's what Albert Ellis called when you use musts, oughts, and shoulds. So the root of these irrational beliefs, I am no good unless I always do well and receive complete acceptance for my performance. And then think about the holidays. That's a good example. I must behave perfectly and be loved and accepted by everyone. You're no good unless you always act fairly and kindly toward me. Well, you must behave in ways that please me. So this is directed at somebody else. If you have expectations for a partner or co-workers, then this is their root irrational belief there. And life is no good unless it always provides me what I want or believe I deserve. And it kind of goes back to that frustration tolerance. Life must be the way I believe it should be. So everything in moderation, and don't go overboard in completely eliminating should, must, or ought from your vocabulary. You must pay your taxes, you should use deodorant, and you ought to brush your teeth. And I have a friend that if I use the word should, I mean, she pounces on me, and I've kind of had to say, now look, Sandra, it's okay to use should every once in a while. So just say, you said should, you said should. So everyone has a personal, favorite, bedeviling, stubborn, irrational belief that especially emerges under times of stress. So this is when that kicks into high gear. When you are under stress, then you just become even more irrational and it escalates the distress. So think about what your irrational beliefs are, your oughts, musts, or shoulds, and then challenge it the next time you catch yourself doing it. So this is healthy stress management. So stress is here to stay. We might as well learn to deal with it. Stress management requires effort, planning, sometimes hard work. But the payoff is really a life worth living, and we must take care of all parts of our being, mental, physical, emotional, spiritual, and social. And then I'd like you to think about your own personal stress management plan. So today, and this is how you commit, today I will take care of my mind, body, spirit, emotions, or relationships by one of those strategies in your handout. And you might even share it with a friend, because that makes you commit even more if you shared it with somebody. And these are some additional strategies that are also in your handout. It's important to ask, does it help me or hurt me to do this? To make this decision, is this going to help me or hurt me? Is this going to help me reach my goals, or is it going to prevent me from reaching my goals? If I eat this 3-pound bag of peanut M&Ms, is this going to help me or hurt me? Well, in the moment, sometimes I think this is going to help me because I need this right now. But so when you have these ideas about things, does it help me or hurt me to compare my house to my neighbor's house, to focus on the success of a friend or family member and compare myself to them? Does it help me or hurt me to focus on why me, and not why not, and why not her, why not him? Does it help me or hurt me to focus on all the bad things that have happened? So what helpful things can you focus on? So just keep that in mind. What are some of those things? And we know that the outcomes of focusing on the bad instead of the good are this. It prevents problem solving. So instead of that, what if you're not doing the if-then, if you're not engaging in the if-then, you're not problem solving, It postpones joy. You cannot experience joy in your life if all you do is focus on the bad and compare yourself and your own situation to everybody else. It also interferes with your relationships because nobody wants to be around Eeyore. Anybody know an Eeyore? Oh, it's me. Nobody wants to be around an Eeyore. It interferes with relationships. It also prevents healthy risk-taking. So if everything you do is based on some bad relationship you had 10, 15, 20 years ago, and no, you don't take the risk of forming new relationships, that prevents joy. And you're focused on that bad thing that happened 10, 15, 20 years ago. Being jealous of the life of someone else doesn't make my life any better. It just makes me miserable and keeps me from creating a life that is worth living for me. This is another specific stress management strategy, and this is really good if you're experiencing a lot of inability to focus and distracted and inattention. One thing we know about mindfulness, and this is kind of a big movement in psychology right now to focus on this mindfulness strategy. Staying in the moment prevents emotional pain because distress comes from focusing on those past events that cannot be changed. You can sit there and think about how horrible your mother was all day long when you were 12, right? Is that going to change it? Do you have any control over it? All you can control is how you feel right now. Distress comes from focusing on future events that may or may not happen, and you may or may not have any control over them. The only thing you can work on is what is going on right now in this moment. So, think of what is your goal, what will you do today to help you reach that goal. Always question yourself, is this helping me reach my goal, or is it preventing me from reaching my goal? So that's a mindfulness strategy. And a lot of folks come in saying, well, can you just give me an antidepressant or something for this anxiety or panic? Well, pills don't cure the stress of living. And that's what most of us are experiencing. It's stress of living. With the economy, there's just a lot of changes in our environment, in our culture right now. This war that we've had for over 10 years now, there's all these things in our culture that create a good deal of angst and distress and depression. So pills aren't going to cure that. They just cover up that emotional distress. They numb us to the pain. Stress will always be a part of our lives. And maladaptive responses, they come back. They reappear over and over and over again if we don't take care of the root cause of the distress. And we can be healthy only by learning these adaptive stress management skills and not by taking a pill. And I like this quote. The sum of our meaningful connections, our connectedness, is the key to emotional health and the surest protection we have against the psychological ravages of worry. By promoting connectedness in your life, you will increase your feeling of power, greatly reduce your sense of vulnerability. There is strength in numbers, and that is one of the best strategies for managing your stress there is to be connected, wherever that is, in your neighborhood, at work, in your home, in your community. I think that might be it. Are there any questions? No questions? Everybody go out there and live stress-free lives? Yeah, really. No? No questions? Oh, well, we got some goodies for you.
It's nice to know it's okay to have stress.
Thanks, Rob.